I'm Mayor Lyrian Gaylor-Baird, and welcome to this community briefing. Joining us again to provide interpretation is Margie Prop. Thank you, Margie, for your services. And thank you to all of you for tuning in to learn more about the latest local developments and how to keep yourself and your loved ones safe. And today's latest local news is that about 120,000 doses of vaccine have been administered in Lancaster County. That means about a third of the county's population aged 16 and older has received at least one dose. And we're so encouraged by this progress and by what it says about how much Lincolnites care for one another and want to help us end this pandemic as soon as possible by getting vaccinated and by taking prudent precautions like wearing masks, washing hands, and doing physical distancing. Significant progress was made last week as we set a new record for doses administered locally at our 4 large-scale clinics. And through those 4 large-scale clinics, we vaccinated about 18,000 community members. We're really grateful for the positive feedback that we continue to receive week after week, and our health department and our community partners really deserve a lot of praise for the incredibly dedicated work that they put into making these events safe and successful. Looking ahead, our vaccination efforts this week will include additional groups in Phase 1B and others who are receiving their second doses. We will continue vaccinating residents 65 years and older, as well as our educators. We'll also be vaccinating licensed childcare providers, coroners and funeral home staff, and grocery store employees, all of whom are next on the state's priority list and who have been on the front lines of this pandemic. We're moving quickly and efficiently through that list provided to us by the state, and we're just so cognizant of how eager all of us are to end this pandemic. And in the meantime, we're also eager to bolster our efforts to address the economic impacts of the pandemic. And this is among the major reasons why I am so pleased to see the federal government step up and invest in the American people with the American Rescue Plan. We're eager to put these resources to work for Lincoln, and we are poised to move our city forward by investing in our local businesses, honoring the work of our frontline workers, and supporting our residents' health and safety. Together with our vaccination efforts, these federal funds will accelerate our progress out of the pandemic and into a brighter and more prosperous future for everyone. So let's find that future together. Ending this pandemic and renewing our economy requires a community-wide effort. For anyone who has yet to do so, there is still time to sign up to get notified when it's your turn to get vaccinated. Just go to our city website, lincoln.ne.gov, and click on the vaccine registration banner at the top of the screen. Help us end this pandemic by getting registered, getting the vaccine when it's your turn, and by continuing to follow those basic practices that slow the spread. Washing our hands, watching our distance, and wearing a mask. And here with more information on our community's progress is Health Director Pat Lopez.
Thank you, Mayor. So I just wanted to share today the interest in the COVID-19 vaccine continues to be very high, as the Mayor said. And we had another record week last week for doses administered at our 4 large-scale clinics. First doses were administered to residents aged 65 and older, as well as educators and school staff. Second doses were provided to residents aged 73 and older. All in, about 18,000 people were vaccinated at these 4 large-scale clinics. We also partnered with the Asian Community and Cultural Center to host a clinic geared towards older adults. We also worked with Bryan Health to hold a second dose clinic for those with serious health conditions. As the Mayor said, about 120,000 doses of vaccine have been administered in Lancaster County so far. This week we received almost 8,200 first doses of vaccine. Our vaccination efforts will include additional groups in Phase 1B and others who are receiving second doses. We will continue vaccinating residents aged 65 and older, as well as educators. This week we will also, as the Mayor mentioned, start vaccinating licensed child care providers, funeral home staff, grocery store staff, food processing manufacturers, transportation, and U.S. Postal Service employees. We are in the process of providing specific registration links to employers. All of these groups round out Phase 1B. We have 3 large-scale vaccination clinics set up for Pinnacle Bank Arena. On Wednesday, residents age 71 and older will receive their second doses of vaccine. On Thursday and Friday, residents age 65 and older, along with educators and child care providers, will be vaccinated. The other Phase 1B groups I just mentioned will also be included in Friday's clinics. We are expecting about 8,000 people to be vaccinated each day. The health professionals in the medical community have been excellent partners in identifying patients with serious medical conditions. Joining us today by Zoom is Dr. Eric Avery, who is the president of Lancaster Medical Society, and he's going to share more about this process. Welcome, Dr. Avery.
Thank you, Pat.
Thank you, Mary. I'd like to take the opportunity to really reach out and have and talk to the community again from the physician standpoint. You guys are doing great. We've seen so much progress, and we are very, very thankful right now for how the community continues to step up in Lancaster County. The COVID numbers are much lower than they have been before, and there is a light at the end of the tunnel, and it's really exciting. But I do want to stress that we still have a long ways to go. We still have a ways to go, and we can do this together. The physician engagement with the health department has really been just multifaceted. There's between physicians, advanced practitioners, all sorts of other medical staff. We have worked with the health department, with the various offices, and we will continue to engage in that and identify high-risk individuals as we continue to go down different phases. The importance of all of this is really the importance of signing up. Just this morning, I was talking to more patients about making sure that they're signing up not only on the state registry, but also on the Lincoln Lancaster County Health Department registry, making sure that we're signing up. And right now, we should really make sure that we're engaging with our loved ones and safely talking to people, making sure that people over the age of 50 are getting signed up to register, making sure that you're, again, doing all those safe things. But then once you get signed up and register, you don't have to call over and over. You don't have to call your doctor's office over and over. We are here for you, and we're happy to take those calls. But once you've signed up on the registry, it's there, and you will get a call for that. I am still receiving a lot of questions about vaccine safety. The vaccines are really safe. They're really effective. And there's a lot of misinformation out there. But yes, they're not perfect. Nothing's perfect in the medical world for the most part. And I would really encourage you to, if you have questions, concerns, I would really encourage you to talk to your doctor, talk to other people who have received the vaccine. And I want to reiterate, because one of my patients told me this morning, they were really concerned about getting the vaccine because their friend had bad symptoms. Well, these bad symptoms were a little bit of low-grade fever, a little bit of body aches, and it lasted for a couple days. That's a normal vaccine reaction. That tells us that your immune system is helping you identify that infection, identify the virus, so that if you do get exposed to it, you don't end up in the intensive care unit on the ventilator or trapped in a hospital away from your loved ones. And we don't want that for you either. So again, right now, I would really encourage people to make sure they're communicating with one another, age over 50, sign up for the registry, and please make sure you're still washing your hands, using common sense, wearing your mask. And if there's questions about whether or not you can have it, whether or not you should have the vaccine, talk to your doctor about it. Don't talk to your mailman's best friend's neighbor's dog. Let us know how we can be there to support you, and we're happy to do that for you. So thank you all for your consideration.
Thank you, Dr. Avery. We really appreciate the continued support and assistance from the Medical Society and its members. Today, I also wanted to share we are also partnering with Tabitha to start vaccinating homebound individuals in the near future. Christy Heinrichs, Tabitha President and CEO, is with us today. Christy, we really appreciate your expertise and that you and your team have brought to this important effort. And thank you for being here.
Thank you, Pat. As she mentioned, Tabitha is pleased to be a part of bringing vaccinations to those who live in our community but are unable to safely leave their homes to be vaccinated. We have been working closely with the health department and other local organizations like the Area Agency on Aging, the League of Human Dignity, and countless other local home care providers to ensure that those who are unable to safely leave their homes still have access to being vaccinated. They fall squarely within the criteria of the 1B, and we are really excited to come to their homes and bring them a solution as they cannot safely get to the community clinics. So we will be working over the next several weeks to ensure that there are vaccinations readily available. Tabitha nurses will be providing vaccinations to more than 1,200 individuals who have registered to date that would otherwise not be able to get the vaccination. We will continue to identify people as needs come up and as the communication regarding the availability of that continues to be pushed out. So we have great expertise in providing support for those who are unable to leave their homes. We've been providing coordination and delivery of services in homes for a long time, since 1966. And we also have lots of experience and expertise now in the delivery and coordination of the vaccination, as we have to date held successfully 10 clinics. So we are looking forward to being a part of the work that has been underway. We're pleased to partner with the health department. We think they've done a great job of ensuring that our community members who need to be vaccinated have been quickly. And we look forward to this being a part of us being able to move to a brighter future. So we fully support the effort. We're pleased to be a part of it. If you have not been able to be registered and believe that you or someone you care for would meet the homebound criteria, so it has a taxing effort to leave home or would fall into very unsafe situations to leave home, it is not too late to register. You can go to the registration. It's been mentioned, lnk.ne.gov, and then click on the COVID-19 vaccine registration, and in the comments, identify yourself as homebound, and we'll work with you to get set up for that vaccination in the coming weeks.
Thank you, Christy. Getting these vulnerable residents vaccinated is really a great step forward, and we truly appreciate the partnership and assisting our families. Again, you can find the latest vaccine information at the vaccine page, as Christy mentioned, at covid19.lincoln.ne.gov. This site includes a list of priority groups as well as who is now eligible for vaccinations. Last week, the Center for Disease Control and Prevention released new guidelines related to how fully vaccinated people can visit safely with others. Individuals are considered to be fully vaccinated 2 weeks after their second dose of the Pfizer or Moderna vaccine or a single dose of the Johnson & Johnson vaccine. We have a graphic that depicts this. Here are a few of the key points. Fully vaccinated people can safely visit with others who are fully vaccinated. Fully vaccinated people can safely visit with low-risk unvaccinated people from one household at a time. Fully vaccinated people cannot safely visit with unvaccinated higher-risk people. In these cases, they need to follow prevention measures. Fully vaccinated people cannot safely visit with unvaccinated people from several households. Everyone should continue to wear masks, watch their distance in public places, and avoid the 3 C's: crowded places, close contact, and confined spaces. You can also find this information on CDC's website at cdc.gov/coronavirus. As more people are fully vaccinated, the CDC will continue to provide additional guidance. Being fully vaccinated allows people to start doing some of the activities they had stopped doing because of the pandemic. Being fully vaccinated also should provide some protection against COVID-19 variants. So far, 2 of the COVID-19 variants have been confirmed in Lancaster County. Our first COVID-19 variant case was confirmed February 22nd. That individual contracted the B.1.429 variant, also known as the California variant. Last week, we confirmed that a man in his 20s contracted the UK variant, also known as B.1.1.7. This is one of 7 cases of the B.1.1.7 variant that have been identified in the state so far. Viruses are constantly changing, and we all need to be aware that variants can spread more easily and quickly, and they can lead to more cases of COVID-19. We want to continue to take preventative actions to control the spread of COVID-19 and the variants in our community. That includes getting the COVID-19 vaccine as soon as it is available to you. It is important to register to receive vaccine if you haven't already. As doses become more available, those who are registered will be contacted to schedule an appointment to get vaccinated. Registration is open to all county residents. After you are finished vaccinating residents age 65 and older, the next priority age group is residents age 50 through 64. If you're in that age group, as Dr. Avery said, and you have not registered, we encourage you to do that soon using the secure online form at covid19.lincoln.ne.gov. The form is available in English and Spanish. And those who do not have online access or who need assistance may call the COVID-19 hotline at 402-441-8006 to register. The health department also has interpreters available to assist callers who speak other languages. And I want to share today our COVID risk dial will remain in the mid-yellow position for the 5th week as our local indicators continue to remain fairly steady. Yellow indicates moderate risk of the virus spreading in our community. Over the last 5 weeks, the number of new weekly COVID-19 cases has varied only about 20 cases, fluctuating between 324 and 343. For the week ending March 14, 328 new cases were reported. We expect to identify more cases of COVID-19 variants in our community, but we can keep our new case numbers down by being consistent and wearing masks, staying at least 6 feet from others, washing our hands, and getting vaccine as soon as it's available to you. We have continued to see a leveling off of the number of COVID-19 patients hospitalized locally. The 2021 peak was 160 patients on January 19. The number has declined before holding steady at about 25 to 30. Yesterday we had 24 COVID-19 patients hospitalized locally, and today we are reporting 26 hospitalized, with 17 from Lancaster County and 9 from other communities. If you monitor our COVID-19 dashboard, you have noticed that we frequently fine-tune data and make additional enhancements to provide the public with more information on vaccinations, testing, and positivity rates. Today, Tommy George, one of our public health epidemiologists, joins us to tell us about some of our newest changes.
Thank you, Pat. All right, so the new additions to the dashboard from 2 weeks ago were a minor addition in comparison to what we've added today. We've updated our vaccination data to represent the single-dose Johnson & Johnson vaccine more appropriately, along with a few other points I'll touch on. So first, the vaccination changes. On the Vaccinations Administered tab, you'll be able to see a basic summary of how many total vaccine doses have been administered, how many people got their first doses, and how many people got their second doses. Since not all vaccinations are 2 doses, we also show how many people have initiated vaccinations and how many people have completed their vaccination series, whether it's a single-dose Johnson & Johnson vaccine or a 2-dose Pfizer or Moderna vaccine. You'll continue to be able to find the breakdown by race, ethnicity, and age. Go through each chart. As we go through each chart, you'll see the age breakdown, and then you'll be able to also see the race and ethnicity breakdown. And then we also have a new chart where you'll be able to find a pie chart showing the percentage of vaccinations we've administered of each manufacturer, Johnson & Johnson, Moderna, or Pfizer. Next, I'd like to summarize some basic changes to the case count charts at the top of the dashboard. These charts now show the number of cases by lab report date and specimen collection date. While these are very similar, the specimen collection date helps us to understand when people are testing positive without as many concerns regarding delays in reporting. So the first chart we have is daily cases by lab report date. So this one just shows you how many cases we've identified each day and when they're reported to us. So this is when we find out about a positive test and it's identified as a new case. So the next chart is the weekly cases reported. This is the same lab report date data being used, but a weekly total instead of a daily total. And then the weekly cumulative by lab report date. So this is a running total of all our cases in Lancaster County. As you can see, this chart appears to be leveling off. So weekly cases tested is the next chart, and this one shows the cases by when they were tested, so when that specimen was collected. So this is helpful when there's a lag in reporting that was common earlier in the pandemic. Thankfully, it hasn't been an issue recently. The next one is a weekly cumulative by specimen collection date. So this is also a running total of all our cases in Lancaster County, but by when they were tested. So again, this is very similar to the lab report date chart and provided for your reference. So the next chart is a hospitalization chart, including data reported by our hospital partners, showing Lancaster County residents in blue and all hospitalizations in yellow. Like cases, this is leveled off as well. We've also added a series of charts summarizing the UNL testing being done in our community, or the University of Nebraska and Lincoln. In these charts, you'll see the number of positives in the community compared to the number of positives from UNL's testing, as well as a chart of this same information for each week. Finally, the local positivity rate is now being calculated a bit differently. The number of all positive tests is divided by the number of total tests. This method, which is also used by the state and other local health jurisdictions around the state, does count people who are tested multiple times, but it also includes all the tests. So the positivity rate for March 7th through March 13th was 4%. Thank you.
Thank you, Tommy, for sharing this great work. I want to thank you and our whole epidemiology department. We were all thrust into this pandemic over a year ago, and your work is just as vital now as it was in the beginning. And through this tireless work, we have been able to better understand our local situation throughout the progression of the pandemic and be well informed for decision making to protect the health of our community. With that, we'd be happy to take any questions from the media.
Dr. Lopez Riley with the Journal Star.
Hi, Riley.
Hi, Pat. Can you talk a little bit more about the positivity rate calculation change? What was the initial formula designed to measure, and do you feel that this will better align with the state's sort of view of the virus at this stage, or is there any trade-off you're making in making this calculation change?
I'm going to answer that, but one of the things that we do know, like I just mentioned, as we've progressed through the pandemic in the course of time, we made continuous improvements and changes to better inform the community. So I'm going to have Tommy talk to you about this change.
All right, thanks for your question, Riley. It's definitely an important one. So the positivity rate, before we were calculating it using a person over person method. So this essentially says one person, one positive test. The new methodology, it includes all the tests. So that allows us to make it more comparable to certain testing in the community. For example, UNL's testing that we included some new charts for today. Since they're testing people regularly and long-term care facilities are also doing this, it helps us to kind of synchronize what we're publishing and what we're reporting with those efforts in our county, other counties, and statewide. It's also becoming more common nationwide to use that same metric. So that's a lot of the reason why we've made this transition.
And tell me, as a follow-up to that, does that, as an indicator of the infection or the spread of the virus in the community, is it more accurate, or is there at this stage, it obviously 4% is a lot, 4.7% is a lot lower than 18 or 20% infection rate, which, which is there a metric that's more accurate in determining community spread?
Yeah, Riley. So different schools of thought, but really when you're looking at positivity rate, the most important thing to consider is how it fits in with all the rest of the data. So if you see the positivity rate declining, for example, but you also really increased your testing, then the reason why your positivity rate might be declining is because you're testing a lot of people who are less likely to be positive. Whereas early on in the pandemic, for example, like if we had an outbreak or something and testing was limited, positivity rate would be really high because testing was so limited. So the point I'm trying to get at is you really need to consider positivity rate as a trend and where it is relative to all the other data points that we have and all the other information that we collect through case investigations. Thank you.
This is Andrew Ozaki from Channel 7 News. I was wondering, I had a question. Are the UNL test results, were they always included inside your positivity rate and your test rates, or have they just now been included, or are they still not included?
We've always captured the UNL test rates. I can have Tommy answer that, but we've always captured those, Andrew.
So as I was saying, as I was walking up here, is I don't have a whole lot to add. That's exactly right. We've always been including the University of Nebraska testing data. It's just the only difference is, like you can see the positivity rate chart that we showed earlier. You're able to see that their positivity rate is very low, so we're able to compare it better. So we were using a different methodology than what you would use if you were reporting on something like the testing that they're doing.
Other questions today?
Does this affect the dial as far as where we're at on the risk range?
Well, I think it's Tom, and as we've said before, it's one of the things that we consider in looking at the dial, but it's just one metric and it has to be taken in. We have to look at all the other metrics that we're looking at and along with that.
And Pat, this is Bill, and I apologize, we're kind of hammering on this, but just to clarify, so the new positivity rate just takes all of the positive tests divided by all of the total number of tests.
Correct.
Okay, thank you.
Yep. And Bill, you can always call Tommy and ask him questions too.
Director Lopez Riley with the Journal Star. The state DHHS put out a new directed health measure today for all counties, I believe, moving everybody into the green. Is there any substantial difference in, is there any comments you'd like to make about what restrictions are still at play here and or what interplay there is with the state's directive?
Well, Riley, I just received the information this morning about the changes, so we've been reviewing those today. I do believe they changed. One difference was in outdoor gatherings. No longer will require an event plan. It's probably one of the major changes that I've noted in there so far. And then some about the state vaccine system. But other than that, the changes, the DHM, from what I've seen in my review so far, it's the same, other than the outdoor gathering.
This is Ellis with 1011 in Lincoln. I just have a question about doses. When you're putting in those orders and the time frame in which you get confirmation, what does that window look like and how does that play into maybe how you prepare for the vaccine clinics?
Alice, that's a great question because actually we don't put in the orders. The state does that. They determine what's going to be ordered and what's going to be allocated for each local health department. And usually now we know, I haven't received notification tonight, but I may know by tonight or tomorrow what doses we will be allocated for the next week. So one of the things that happened during the snowstorm, for example, we were fortunate enough to get some doses, but we didn't get any doses until Thursday. And so we obviously couldn't plan a clinic not knowing if we had the doses. So we're catching up and cleaning up the rest of that right now, and then we'll be going forward. Our doses will be about 80. It's actually 8,190 doses, so we say around 8,200 doses. We certainly are hoping that we will get more. We've also asked about additional allocations of Johnson & Johnson. The state has been told they may be able to put in an order next week for the following week, but we don't really know what that order will be or how much allocation of Johnson & Johnson we will get. We did use the 3,000 doses that we received to vaccinate educators.
This is Bill. More on vaccines administered. I'm noticing, February you guys averaged between 9 and 11,000, and then last week 22,500 administered. Do you think that 20,000+ number is something we will consistently see from here on out?
Probably close to that, Bill, because the plan is right now, going forward, we planned out through May or through the rest of April. We'll be doing 80. Close to 8,200 new doses every week and 8,200 second doses. Now that we're getting some consistent dose amounts that we can plan around and a potential time frame to do that. And that's why you'll see most of our clinics are scheduled later in the week just to make sure we have the vaccine that we need to carry out the activity. And we also, at the same time when there was that short fall of some of the vaccine that coming in later in the week was also then the state tournament was starting and we had to change locations and make adjustments, and we also wanted to use the Johnson & Johnson vaccine and get our educators vaccinated. So going forward.
Oh, sorry, go ahead.
Going forward, you'll probably see close to 16,000 or more a week.
You talked about planning through the end of April. Is it your anticipation that on May 1st, as the president directed last week, that the county will have opened up vaccinations to all adults?
Well, Bill, I can't predict that far in the future with COVID. It's a lot of times a day-to-day effort, but right now we're coming to close on our 65 and older. We're going to finish our educators this week and move on to those others groups in phase 1B. So I'd like to be there on May 1st. That would be wonderful if we had that much vaccine that we could move that way.
I'm sorry.
Go ahead.
Go ahead.
Andrew?
Oh, I'm sorry, Pat or Mayor. I guess St. Patrick's Day is tomorrow, and what's your hope or what's your message to people?
Well, I think it's the same message we've been giving. We want people to enjoy themselves, but to do it safely, to wear their mask, watch their distance, and wash their hands. I think that's the same message our restaurants and others have been providing to those in the community.
I have a question for the mayor.
Hi, Riley.
Hi, Mayor. Does the city stand to receive any stimulus funds from the latest stimulus package meant to provide coronavirus relief?
Yes, that's one of the reasons why I'm so pleased that this has passed, because it's one of the ways that we can get a direct allocation of funds that we can put to work towards our vaccination efforts, towards protecting public health, but also towards investing in our economic recovery, supporting businesses, and getting us back to a more familiar way of life. Those resources it's very exciting to have the opportunity to deploy resources on behalf of Lincoln's people.
Do you have details on what, how much, and kind of when you'll be able to start spending it?
We're eager for those details. We anticipate somewhere in the neighborhood of $45 to $48 million coming to Lincoln. They're still working out guidance for how those dollars can be spent in detail. We've had that with the past stimulus packages. The state, of course, had to wait for guidance in order to start distributing funds. We want to make sure that we're absolutely following the guidance so that we can really be as effective as possible and be in compliance with the expectations and regulations. But again, the goal is to help us get out of this pandemic by hastening the vaccination efforts, more doses, more testing, protecting public health, which is so vital to restoring consumer confidence. So at the same time that we're protecting public health and restoring consumer confidence, we're looking to then support businesses, particularly those that have been disproportionately impacted by the pandemic. Our hospitality industry, of course, everyone is very concerned and wanting to support and getting them back to where they were before the pandemic. So it's a wonderful opportunity to be investing in the strength, resiliency, and recovery of our economy and our people. Any other questions? All right, well, in closing, I just want to say thank you again to our guests today. Thank you so much to Dr. Eric Avery from the Medical Society. Thank you to Christy Hinrichs from Tabitha. And thank you to Tommy George and our EPI team. This has been such an incredible collective effort. Our partnerships have mattered so much. And we are all racing together as a city, as a county, a state, and a nation, even the world in this race against the virus and its variants. So we are racing to push vaccines into the arms of community members as quickly as possible. Thank you again to all those of you who have already registered to be notified when it is your turn to get vaccinated. For those of you who haven't, again, the website covid19.lincoln.ne.gov, where you can register to get notified when it's your turn. Your willingness to be part of the solution is how we will end this pandemic together. Thank you for your willingness to be part of the solution. And thank you today for tuning in. Thank you, Margie.